So things are quite challenging at the moment here on the COVID ward at King's. We are facing a number of challenges that really make life quite difficult. So one is the severity of the patients who are being admitted. So we know there's lots of cases in the community that actually people are not getting so sick, but there are still people being admitted to hospital and they are still getting very unwell due to COVID pneumonia. And that's quite stressful for us to be looking after, although things are much better now that we have more treatments, more to offer. A major problem for us is staffing. So most of our staff are fully vaccinated, but they still have to isolate if they're contacts, and we still have had staff contract COVID, and that puts huge pressure on our systems. We are always kind of running with just enough staff, and anything that puts that in danger is a real problem. So we're spending quite a bit of time having to reshuffle and be extremely flexible, and people take on different roles or wards to make sure that we're well staffed.
We are very stretched from a nursing point of view. We've had lots of sickness due to COVID, positive cases and contact. The nurses are all very tired because they're all having to take on a lot more responsibility than they normally would due to the stretched staffing. We're seeing majority of patients that are coming in are not vaccinated, and they're also younger as well this time around.
It's a mixture, but it's what we've seen over the last 22 months really, and it's undeniably the bigger proportion are unvaccinated, and they tend to unfortunately have the worst outcomes as well, and then we are seeing some patients who have been vaccinated but some time ago. So I guess there is a group of patients there who haven't had their boosters, and unfortunately we do see one or two patients who've just had boosters, but probably not time yet for that to be fully effective. And sometimes there are people who are very unwell but have COVID as well, and they may have other medical problems, and certainly in the extremely vulnerable patients. The vaccination clearly helps, but it's not 100% preventative, and we do have very vulnerable patients who have been fully vaccinated who unfortunately have become unwell as well on intensive care.